Good afternoon. Good afternoon, distinguished guests, delegates, coalition members, ladies and gentlemen. Welcome to this webinar organised by the Coalition of Action on Healthy Diets from Sustainable Food Systems for Children and All. Today's session, thank you very much for joining. The webinar is titled Aligning Policies for Healthy Food Environments, Exploring the Role of Food Retail Environments for Improved Diets. My name is Christina Vogel. I am wearing two hats today at this webinar. The first one is as the Professor of Food Policy and Director of the Centre for Food Policy at City University of London. And the second is as a steering committee member of the Healthy Diets from Sustainable Food Systems Coalition. Our centre has been one of the founding members of the coalition since its formation during the UN Food Systems Summit in 2021, and we're truly delighted to be part of the important activities of this coalition. Turning to the topic of today's event, as many of you will know, our current food systems are making humans and our planet sick. The Healthy Diets from Sustainable Food Systems Coalition aims to act as a mechanism for accelerated and coordinated action by stakeholders across food systems so that we can have a collective impact at the country level. It is through sharing experiences and championing policy action that we can work to ensure healthy diets from sustainable food systems are accessible for all, particularly for those most vulnerable to food insecurity and climatic events. The coalition, for those of you who don't know, is made up of 22 country members. It also has a wide range of about 20 UN agencies, research and academic institutions, and civil society organisations. If you're not yet a member and are interested, please do reach out to the Coalition Secretariat via email. Today's session, thanks again for joining. It focuses on a really pivotal area, particularly the role of food retailers and markets in food systems transformation for human and environmental health. Many of you will know that food retailers and markets are the setting that the vast majority of citizens engage with to acquire their food. They form a fundamental part of our daily lives, the part, in fact, of this food system that most citizens understand the best. Yet the environments of food retailers and markets do not represent the food-based dietary guidelines that our governments promote. Unhealthy food is often cheaper, more heavily marketed and more widely available than healthy foods in these settings. It's this situation that makes unhealthy foods the obvious choice and the straightforward choice for many citizens, particularly those with fewer monetary and time resources. It's important that we build the evidence to show that these settings do not make healthy foods easy, affordable, or the appealing choice is really important for policymakers. So too is it important that we listen to citizens about their experiences of shopping for food and what they want retailers to do to support them to make healthier food choices. This evidence is really important and it can subsequently lead to, ideally, comprehensive policy action. In the UK, my research group and others have been working on gathering this evidence to present policy options to policymakers that can improve the healthfulness of retail food environments in my country. We've seen really great policy action, for example, a tax on sugary beverages and the banning of the placement of unhealthy foods at checkouts, aisle ends and store entrances. But it's the coordination of policy action that has been undermined, particularly by government deciding to introduce delays on policy implementation, particularly on advertising and price promotion bans. I am really looking forward to hearing more from our guest speakers today about their own government's efforts and what they're doing to take action on improving these important food settings and food environments. It really is through sharing examples of policies in action that are being implemented in food markets and retailers to create a healthier setting that is the key objective of today's webinar. It's this diffusion of innovation that can help to improve subsequent action. And we've seen this in the UK as the Scottish Government is currently learning from what has been done in England to take better, stronger policy action that can be more beneficial for health and nutrition. Today, we have a truly excellent lineup of speakers from whom I'm sure we will all learn a lot. But before we launch into the program, I wish to just share some of the housekeeping details for today's webinar. Firstly, today's session is being recorded. This recording is going to then be used for promotional note-taking and archival purposes. Secondly, we invite you all, please do, ask your questions of today's speakers. You can do this in two ways. Firstly, via the Q&A function that you can see at the bottom of your screen. You can use this function to add your questions throughout the session. These will then be addressed in the discussion section of today's programme. Please be sure to add the speaker's name if you have a specific question for a particular speaker. The other mechanism is that we will invite participants today to raise their hand and then to offer and ask their question in person during the Q&A session later on today. Thirdly, I'd just like you to please regularly check the chat box. Throughout today's session, we will be dropping information and links to the resources that speakers mentioned so that they'll be actively dropped into the chat as they're being mentioned. So please do keep an eye on the chat. Finally, if you have any problems or technical issues during today's session, please do just add a message in the chat box and someone will offer you support. We've got a great technical team supporting us today. I'd now like to invite the speakers of the first segment of today's programme, who are also the co-organisers of this event, to turn their cameras on if they haven't already. I welcome three members of the Market Linkages and Values team in the Food and Nutrition Division at the Food and Agricultural Organisation, or FAO's headquarters. Please do come and take the floor. First of all, I welcome Anna Puwak, who is an urban food systems expert, Sarah Hugenworth, who's Nutrition and Rural Development Specialist, and Marcelo Vicovaro, Sustainable Market Specialist. We really look forward to your overview of retail food environments and how they can really help in improving healthy diets. It provides important information for background for this session, and I was informed that just last week you conducted a 3-day workshop on this very topic, together with colleagues from the Global Alliance for Improved Nutritional Gain and Ricolotto. I understand that these workshops brought together over 80 experts, and it just highlights the energy and activity that there is currently around this very topic. I also picked up on one of the points during those workshops where you referred to food markets and retailers as the hidden middle rather than the missing middle. And I just wanted to highlight and say that this is quite right, as their presence is very much felt, yet their potential as a setting for improving diets for health and sustainability has been yet to be fully realised. So thank you very much. We look forward to hearing more about this particular point and the information in general during your presentations. Over to you, the floor is yours.
Thank you very much, Christina, and good afternoon to all of you joining us here today. I hope you can hear me well. So without a further ado, let me start with a brief overview of why we are focusing on food environment policies for healthy diets today, and then my colleague Sarah will explain why we want to talk about food retail environments more precisely. So generally speaking, the approaches in agricultural programs, policies, and investments for addressing malnutrition and food insecurity have traditionally focused on the production or consumption end of the agri-food systems, while the focus on the midstream distribution system that connects farmers and consumers has been quite limited. And this is not so surprising because the challenges that directly impact farmers and consumers require more urgent and time-sensitive interventions, while the middle of the food system, which includes things such as transportation networks, infrastructure, processing, logistics, wholesale and retail, and of course includes food environments, is seen as less critical in the short term. Now, more specifically, in terms of the nutrition-sensitive agricultural or value chain approaches, we know from experience that they have certain limitations. For example, value chain approaches that target nutritional outcomes by design, they have to focus on a single commodity, maybe missing out sometimes on a whole of diet perspective. Then on the consumption side, we often see interventions that target consumer awareness, education, which are absolutely critical. But then what is also needed and what is missing are policies that engage more actively with the food industry and regulations as well. So basically, what we want to highlight here is that this midsection of food systems and food environments should be added to the formula of solving malnutrition and food insecurity, because these policies can positively reinforce the ends of the spectrum interventions and policies that already exist now. So in recent years, food environments, as you can see here, have progressively been prioritized and included in the food system framework for nutrition since 2016 and 2017 in the major global publications by the high-level panel of experts and the global panel of international experts. And as we can see on the image here in the 2020 edition of the HLPE report, the framework directly connected the food environment with impacts on diets. And one thing to say is that, in fact, the food environment research itself isn't that new, because we know that we have earlier studies from the 1980s, 1990s, but in high-income countries. But what is new is that food environments have gained more recognition in these global frameworks and policy discussions more recently, especially after COVID. And another important change is that the focus of the research is slowly shifting from high-income countries and obesity and impacts on obesity to low and middle-income countries and malnutrition in all its forms. So how have food environments been defined, actually? So there is no overall adoption of one single harmonized definition, and the definitions still vary to a certain degree. But here we decided to present the one which was coined by HLPE in 2020, which says that the food environment refers to the physical, economic, sociocultural, and policy conditions that shape access, affordability, safety, and food preferences. Food environments overlap with food supply chains, consumer behavior, and diets. So apart from the definition, there are also food environment frameworks, and there are in fact several frameworks that have been adopted, but we decided to present here one of the earliest frameworks, which is produced by Informas Network. And Informas stands for International Network for Food and Obesity, Non-Communicable Diseases, Research, Monitoring, and Action Support. And the network is coordinated by the University of Auckland in Australia. And we are delighted to have today with us Professor Boyd Swinburne representing Informas to give closing remarks to this discussion. So we chose to present the Informas framework because it has food retail as a standalone component that deserves to be studied and considered in the policy and implementation. But of course, that's not to say that all the other components of food environment framework are less important, because to achieve a systemic approach, we need to act on all of them. And finally, Informas also developed a healthy food environment policy index in 2013 that you can see here, to address the extent of the implementation of recommended food environment policies by national governments compared with international best practices, and to derive concrete priority actions to fill implementation gaps. So this food EPI includes two components, policies and infrastructure support, 13 domains, and 47 good practice indicators. This food index has been so far implemented in around 15 countries, if I'm right, including the countries whose representatives are with us here today on the panel. And finally, and before I give the floor to my colleague Sarah, I just want to highlight that the food retail policy domain is still the area of action with the lowest policy and implementation score as per food EPI index across the board. But this only confirms that we have to put a lot more focus and effort in this policy domain for it to progress and have a more positive impact on diets. Thank you, and over to you, Sarah.
Thank you, Anna. I hope you can hear me as well, and thank you all for joining. So next slide, please. Thank you. So zooming in on food retail environments, They include all food retail outlets like supermarkets, independent grocers, and street food vendors, as well as traditional retail outlets, such as traditional fresh food markets, or alternatively open air, wet, or territorial markets, as defined also by the recent IPS food report, and also wholesale markets. So these markets are where most of the population in low and middle income countries, especially low income consumers, purchase the majority of their food on a daily basis. So in the food environment framework presented by Anna, FAO's long-term engagement has focused mostly on food markets. So those markets where governments have more agency, so territorial markets and wholesale markets, as opposed to large modern retail outlets such as supermarkets. And especially in the last years, the Food and Nutrition Division of FAO has been working on how can we leverage or unveil the potential of those markets to enable access to healthy diets and especially improving the availability of nutritious and diverse food, framing these markets as key components of the food environment framework, especially since research so far is predominantly focused on supermarkets in high-income countries. Next slide, please. So healthy diets are achieved by consuming a diverse variety of food that provide adequate nutrients and bioactive compounds essential for health, and maintaining also a balanced intake of macronutrients and moderating foods and nutrients associated with risk of non-communicable diseases when consumed in excess. But there's a precondition of that, which is that to enable access to healthy diets, nutritious and diversified food must be available, accessible, affordable, and desirable to consumers. We know that in many low and middle income countries, over 50% of food consumed is purchased. And this is true even for rural households and in rural areas. In certain regions, such as Sub-Saharan Africa and South Asia, these numbers are even higher. And we know that nearly 80% of consumed food is sold through food markets. These markets are especially important for the supply of fresh and more perishable food, including fruits, vegetables, legumes, crops, and also animal products, which are crucial for nutritional outcomes and healthy diets. For instance, also wholesale markets play a crucial role in food supply chains as they handle very large volumes of produce and provide access to a diversified diet at an affordable price, especially when they also act as retail points. So we can affirm that food markets are at the core of agri-food system. They function as physical places where supply and demand meet, playing a crucial role in shaping local food environments. Next slide, please. However, despite their importance for food security and nutrition, food markets are often invisible and neglected in national policy development, investments, and also plans targeting nutrition, usually due to information gaps or lack of data, or also lack of understanding of their potential. This also applies to key midstream intermediaries in food supply chain, such as micro, small, and medium enterprises, processing, handling, and distributing food to these markets. So those markets and those market actors are often hidden from the debate, hence the hidden middle, but they're not missing, they're there. Midstream supply chain actors, which move about 65% of food consumed in Africa and South Asia, are growing quickly, and they're succeeding where enabling conditions are present. But often the reality is that they operate in very poor business environment within markets. And I'm referring to, for instance, the inadequate infrastructure, access to water, lack of electricity, absence to cold chain and cooling storage facilities, etc. So challenging market conditions impact the profitability of both food suppliers and retailers and affect the food quality, desirability, and convenience of the food that is then available to consumers. Also, peripheral market infrastructure need to be considered in this picture, like roads, highways that in certain settings make the logistic and distribution of food very challenging. Market and market actors, in order to function effectively, also need support in improving the overall market governance. They need security in transportation, better access to financial mechanisms, reduction of policy-related constraints, such as regulation for food safety and good commercial practices. So policy or public policies and investments can influence all these aspects. They can consider and inform the location selection and improve peripheral infrastructure, therefore impacting food distribution and consumer access, as well as drive market infrastructure investments, particularly in wholesale markets and in their governance. I'm finishing. Prioritizing markets where governments have more influence can streamline efforts, allowing entities working with governments and public agencies to support initiatives that increase the availability, affordability, and quality of fresh food, and consequently also all the livelihood opportunities in these markets. So in a nutshell, food markets are at the core of local food systems. When well functioning and with enabling conditions present, they have a great potential to enable access to healthy diets by supplying nutritious and diversified food, and thereby influencing the broader local food environments. Thank you. I'll stop here and over to Christina. Thank you.
Thank you. Thank you very much. What a really great background and context that you've provided for us all. Particularly, I love the difference of policy options for SMEs versus those that we might use for multinational organizations. So thanks very much. But without further ado, I'm going to invite Jason, our next speaker, our keynote speaker. Welcome, Jason Bejon. Jason is Director of Food Policy Division in the Strategic Policy Branch at Agriculture and Agri-Food Canada. And Jason, you're presenting on behalf of the Canadian government, who I must say are not currently members of the coalition. So we're inviting you as a guest, and a very important guest that is too. So thank you very much. I'm sure we've got lots that we can learn from, particularly how your government has really done a great job at aligning policies for comprehensive action. So thanks very much, Jason. Over to you. The floor is yours.
Hey, hello everyone, and thank you, Christina, for the introduction, and thank you to the Coalition for the invitation. The topic of today's webinar on aligning food-related policies is of keen interest and has been something that we've been working on for the past 5 years. I'm happy to share with you some of the progress we've made and to benefit and learn from this coalition, other countries, and food system experts. So I'm going to begin with briefly outlining some of the key federal policies and investments in Canada that more directly relate to food environments, followed by challenges facing Canada's food systems, the approach we've taken through the food policy to better align and coordinate policies, and then going to touch on some of our planned work ahead. So food environments in Canada are shaped by a complex web of policies, programs, initiatives at national, provincial, territorial, and municipal levels. There are a number of federal departments and agencies in Canada that are taking action to positively impact food environments. For example, the Government of Canada supports community-based projects through programs such as the Local Food Infrastructure Fund and the Healthy Canadians and Communities Fund. These programs aim, in part, to improve access to local, nutritious, and culturally appropriate foods for populations who face challenges, including with food security. An example of a funded project is the Market Greens Initiative, which provides fruits and vegetable vouchers for people in low-income neighborhoods that can be used as participating markets. The federal government is also leveraging market mechanisms to help strengthen local and sustainable food supply chains, while also improving food environments for equity deserving groups. In 2023, under the Sustainable Canadian Agriculture Partnership, the federal and provincial governments supported Direct Farm Manitoba in delivering an expanded Manitoba Community Food Currency Program to empower food insecure Manitobans to purchase locally produced fruit, vegetables, meat, and other nutritious foods at farmers markets. The government is also working together with Indigenous and Northern partners to improve food environments in remote areas through a suite of programs that support community-led initiatives that aim to strengthen local and traditional food systems. This includes programs such as the Nutrition North Canada Retail Subsidy, which helps to lower the cost of nutritious perishable market foods in northern isolated communities, as well as the Harvest Support Grant and the Community Food Programs Fund, which increase access to traditional food by supporting hunting, harvesting, and food sharing activities. Initiatives such as the Northern Isolated Community Initiatives Fund are also helping to cultivate local, community-led production processing capacities in remote Indigenous and Northern communities. For example, investments that help to support the revitalization of the Mackenzie Delta reindeer herd, so they can one day provide a sustainable source of protein to all Inuit living in Nunavut in Western Canadian Arctic, as well as the deployment of a mobile abattoir to enhance local processing capacity of country food. Notably, Health Canada is responsible for the introduction of regulatory and non-regulatory measures to promote healthy eating and improve food environments. This includes improving the nutritional quality of foods and labeling, as well as advancing work to restrict marketing of certain foods to children. So kind of moving on, important strides have been made. While important strides have been made, Canadians continue to face challenges to healthy eating. Highly processed, energy-dense foods, products high in sodium, sugars, and saturated fat have become more available, heavily promoted, and relatively more affordable compared to minimally or unprocessed foods. We see that across the socioeconomic spectrum, the frequency of fruit and vegetable consumption in Canada remains low. In addition, almost half of the overall energy intake of Canadians comes from ultra-processed foods, some of which contribute excess sodium, saturated fat, and sugars to diets. Available Canadian data has also shown, with more severe household food insecurity, ultra-processed food consumption is higher, and diet quality generally lower among both adults and children. Diet-related chronic diseases represent a substantial economic burden at an estimated 15.8 billion Canadian or 10.8 billion euros per year in healthcare costs. Not all people in Canada have access to enough safe, nutritious, and culturally appropriate food to support healthy eating. In many Indigenous, rural, and remote and northern communities, there are disproportionately high rates of food insecurity and serious challenges to promoting healthy food environments. Indigenous food systems have been severely impacted by historical and ongoing trauma associated with colonialism. A lack of community food infrastructure, climate-related impacts on access to traditional food, and barriers to local food production have all contributed to a shift towards consumption of energy-dense and nutrient-poor market food, which may be more readily available. Black and other racialized people also have disproportionately high rates of food insecurity and often live in lower income urban neighborhoods with high access to fast food outlets and convenience stores offering less nutritious food options. As most of you are well aware, creating supportive food environments that promote healthy eating is a complex issue that requires the active collaboration of all food system stakeholders in order to be successful. Stakeholders and partners often call for joined-up approaches, including the formation of partnerships and the coordination of multiple actions across sectors, including agriculture, health, education, and social services. In order to significantly influence the availability, quality, and affordability of foods and food environments, this is where the food policy has kind of come in to play an important role in helping to bring those together. The Food Policy for Canada was launched in 2019 following consultation with over 45,000 people from diverse sectors across Canada. The food policy set a vision to ensure that all people in Canada are able to access a sufficient amount of safe, nutritious, and culturally diverse food, while also building a more resilient and innovative food systems that sustain the environment and support the economy. A key success of the Food Policy for Canada was the establishment of the External to Government Canadian Food Policy Advisory Council and the Internal to Government Interdepartmental Committee on Food Policy. Both groups were instrumental in advancing Canada's leadership in the 2021 United Nations Food System Summit and the development of Canada's National Pathways document, which outlines actions being taken across Canada's food systems to make progress towards achieving the Sustainable Development Goals and the Food Policy for Canada's visions. Stakeholders and partners participating in this engagement process have called for Canada to deepen its efforts to coordinate and align existing federal food-related funding and to make new strategic investments to make nutritious foods more available, affordable, and accessible for all Canadians. Both the Canadian Food Policy Advisory Council and the Interdepartmental Committee on Food Policy provided a focal point for the cross-sectoral and interdepartmental discussions on food-related issues, including the creation of Canada's first ever National School Food Policy and Program. The National School Food Program is being supported by a $1 billion Canadian investment from the Government of Canada over 5 years as an adjunct to other funding for school food, including from Canada's provinces and territories, Indigenous communities, and civil society organizations. Recognizing the importance of school food programs in shaping healthy food environments for children, the Food Policy for Canada provided an important platform to support the development of a comprehensive national school food policy, which outlines the federal government's long-term vision for school food programming in Canada. This policy reinforced that school food programs involve more than just putting food on a plate. and that there's a need to reflect the entire system that feeds our kids, including the food supply chain that gets food into schools, as well as the settings in which children eat. To this end, the policy includes guiding principles and objectives that support healthier food environments within school communities. For instance, the policy underscores the importance of ensuring that food served through these programs align with Canada's national healthy eating recommendations, integrating food and nutrition literacy into programming, supporting local food systems, and safeguarding children from the marketing of highly processed foods and beverages. So one of the key lessons and something that we're constantly working on, as I'm sure others are as well, is to showcase the improved return on investment that can be achieved through greater coordination and coherence among programs with the aim to improving food environments. In Canada's most recent budget, the Government of Canada announced renewed and expanded investments, which will help improve food environments for people living in Canada, particularly for populations who face significant barriers to food security and healthy eating. Many of these new investments will also be jointly delivered by federal departments and agencies to support stronger alignment for optimal results. So this represents an important step for government, moving from simple coordination to more integrated joint up action to achieve better outcomes for people in Canada. For example, the Department of Agriculture and Food Canada will be leading the implementation of a new iteration of the Local Food Infrastructure Fund, which will aim to support infrastructure that enables enhanced action on community food security and improved food environments, with priority given to Indigenous, Black, and other equity-deserving groups. Part of this fund will also support community organizations to improve infrastructure for school food programs as a complement to the National School Food Program policy, which is being co-delivered by 3 different federal departments. The implementation of joint initiatives such as the National School Food Program to support healthier food environments shows a lot of potential. We're also continuing to explore ways to enhance collaboration across federal departments and agencies to pool resources, expertise, and policy levers, streamline administration, establish shared measures to demonstrate collective impact, and better ensure trade-offs are considered upfront and shared objectives are baked in, as opposed to addressed after the fact. It also offers the potential for organizations who are looking to improve food environments to access funding for multi-component projects or solutions through a single process, as opposed to navigating multiple programs across various departments and agencies to stitch something together. Ensuring that food environments in Canada feature nutritious foods that are affordable, accessible, and culture appropriate to all residents is critical towards improving equity and community health. Moving forward, the Food Policy for Canada will look to achieve its core objectives, which include improved food environments so they support health, while also supporting impacting social, environment, and economic goals. We're also monitoring opportunities to develop more robust and consistent measures to effectively monitor food environments and food security in Canada to evaluate the contribution of these efforts. Thank you for the opportunity to share with you some of our work in Canada through the Food Policy for Canada. That there is still much to be done, and we would very much welcome the opportunity to connect following the webinar to exchange and share respective best practices, lessons learned. It's essential that we continue to work together across sectors and borders to share experiences, learn from each other, and improve the outcomes of our actions moving forward. Thank you.
Well, thanks very much, Jason. What a really excellent presentation. You gave some really, really clear examples of how your government has been really working together to address many of the issues that will be similar and feel very true across listeners and across countries and delegates listening from different countries. I particularly value the focus on traditional and culturally relevant food as well as health and sustainability, and that's really very inspiring, and how you've come together to sort of systems drivers, which is really great. So really looking forward to the Q&A where we can explore some of those examples in greater depth. So thanks so much, Jason. Just a big reminder to everyone listening, please do add your questions to the Q&A section down the bottom of the screen, and Jason will be able to answer any of your questions in the Q&A session later on in today's program. Next, we're going to move on to our presentation, our panel, where we're going to hear from a collection of presentations from coalition member countries who will speak about their experiences of working to improve the healthfulness of food environments in their own countries. We've got a really lovely diverse range of coalition member countries speaking today, who cover different regions of the world and have really different experiences, both successes and challenges, in implementing robust environmental policies around tackling food markets and retailers. So I'm delighted to invite our 3 panelist speakers to the floor. First of all, we have Heli Kusapalo, who is a senior advisor at the Institute for Health and Welfare in Finland. Welcome, Heli. We also have Dr. Mugaleta Tima Sisi, who is a senior food systems advisor at the Ministry of Agriculture in Ethiopia. And we have Dr. Claudia Tremont, who is the technical consultant at the General Coordination of Food and Nutrition at the Ministry of Health in Brazil. So thank you all for joining us today. I'm going to hand straight over to our first panelist in the interest of time so we can have time for discussion. So please welcome Dr. Heli Kusapalo from Finland. Thanks very much.
Thank you. So I go straight on the topic. Thank you for taking this excellent topic on board. And next slide, please. The Finnish nutrition policy in brief gives many ideas and learnings to this whole topic. Where the policy, food policy and nutrition policy relies in Finland is that we have regular nationwide health monitoring system. We are convening epidemiological studies which have helped to understand the associations between diet and health. And based on this knowledge, it has been possible to formulate an effective functioning policy where actors from various sectors of work together and where healthy environment is considered. Next, please. So I have put here the ideas how to promote better nutrition, what we have experienced over the years in Finland. As I already mentioned, research and monitoring is important, but also we are working through various boards in the whole food system. And recently we have just aligned our work with the Nordic community, as last year the nutrition recommendations and dietary guidelines were published in Oslo, but this year we are working on our national guidelines because there are many differences also how we approach the guidelines. Next slide, please. To put it together, since 1982, we have regularly monitored the nutrition of the adult population in national FinDiet studies. And surprisingly, we haven't monitored young people's, children's and adolescents' diet in regularly. There are, of course, many studies where this topic comes up, but now our next objective is to continue with regular nutrition monitoring to children, adolescents, and of course different population groups like vulnerable groups as pregnant and lactating women and the elderly. Next, please. So we participated in Food Epi survey in 2020, and there are several points that we learned. In general, indicators on structures, governance, funding were appraised that we are doing this quite well. Sorry about the Finnish language on my slide, but to put it brief, we have also many challenges in policy actions concerning package labeling, food retail, product placement, fast food restaurant supply, restricting unhealthy food and drink marketing to children, which I will talk more about. So school meals, we are also seeing, as our Canadian colleague meant, that school meals are really an investment in the future because they create social protection, they improve health and learning capacity, and also they add to the economic growth of the whole nation. A stronger local economy and heritage can be provided through school meals, and this is a source also for local products and promote local food culture. This is the picture how we ration. In Finland, we created the whole school meal system when Finland was the poorest country after the Second World War. So we had very good political decision makers, wise men, who aligned the education and food security together. So Finland has laws that ensure that all the children can attend school, and they are entitled to one warm meal per school day in Finland. Since 1948, the school meal system has developed to be a very detailed one in many ways, and the flower on the left hand of the slide shows that how to approach our school meal system. Eating and learning together is the school meal guideline for our caterers, for our health system providers, for all. So also there is the school meals premises where the school meals are served. They are also having certain criteria how to put it. So as I heard, safety, sustainability, free of charge, appropriate meals, balanced meals, so that they are appealing and that the meal is supervised. Those are the concerns that helped us to create the current system. Next slide, please. Why I wanted to take this up, because together with the University of Helsinki, we were participating to the survey of a comprehensive approach in protecting children from marketing. Next, please. So this survey was conducted a couple of years ago, and we were taking seriously the challenges of the digital world and how the social media marketing is targeting to children and young people. Next slide, please. Just to put the conclusions of this study, according to the qualitative research that was conveyed, marketing of unhealthy products are targeted to children in social media and on packages. Partly the content can be regarded as being against good practices. More research is needed in this. The present directions and self-regulation practices are apparently not adequate to prevent harmful marketing to children, and that's why we took up this topic. Next slide, please. Self-regulation of food marketing doesn't seem to be adequate to guarantee children's right to health. That is the point in why we are so concerned of this. Should it be legal restrictions? We don't know. Or would it be sufficient with more strict control, including nutritional evaluation as a part of the ethics in marketing of self-regulation? Or how should it be organized? We don't have the silver bullet to this problemacy, but also the age limit, whose access to harmful markets should we limit. of course, if we think who are defined to be children, it's maybe under 18 years old, and also we have the 15 years time limit here. So we recommend the development and use of science-based nutritional profiling system for defining unhealthy foods. An optimal model doesn't exist. So these are my main messages at this point. And through school system, because school system is helping. Every child goes to school and they spend a lot of time, and if the topics at school are appropriate, then we can also maybe reach the objectives that we want. Thank you.
Thank you very much, Heli. That was a really interesting experience from Finland, and I particularly loved your flour and, you know, with school food environments, and then the need for comprehensive approach, as well as marketing being a really important component of retail food environments. There's some really key points, and of course that self-regulation is inadequate. I think there's a strong body of evidence now to indicate that and support what you just said there. So thanks very much. I'm now going to turn to our second panelist from Ethiopia, Dr. Sise. We're very pleased that you could join us today, and over to you to hear insights from Ethiopia. Thank you.
Very much. Good afternoon, good morning. I'm going to present about food environment related policies in Ethiopia. Next, please. You know, like similar to the other developing countries, Ethiopia is struggling with triple burden of nutrition insecurity because we have undernutrition issues, micronutrient deficiencies. Now there is an emerging one, the non-communicable disease due to overweight and others in the cities. Those happen because we have a limited consumption of nutrient-dense foods, and consequently our food is monotonous. This is because there's no attention for healthy and nutritious diet approach prevention. Next, please. You know, 84% of the Ethiopian population is unable to afford healthy diet. The need for Africa, leave alone for the world. Apart from 4% of the population are unable to afford nutrition. So the problem is, next please. Undernutrition, with the incidence in country, 39% of the children are almost over the mean of the African sea. Next, please. When it comes to the other side of about unhealthy food consumption, especially in the urban and cities, 50% of the children tend to consume sweet beverage. And the youngsters in city, they love to consume fast foods like the burgers and the pizzas, which is full of fats, salts, and others. So the burden here is, it's not only undernutrition, but consumption of unhealthy foods. Next, please. So what are the policy landscapes in Ethiopia? We have developed a Ethiopian food system transformation roadmap. We can work on not only the food environments, unlike the other countries, because we don't have that environment per se for now. We have to produce first the food itself, the nutrient-dense foods. So we are going to work on the food supply, food environment, and consumers. Next, please. Here are some policy indicators. They are not directly related to healthy food policy index, but we have a food and nutrition policy, it's a strategy, Secretary Declaration, the Ethiopian Food System Transformation Roadmap, food safety and quality strategy, nutrient-sensitive agri-food system strategy, and the others that can create the undernutrition as well the healthy diets. Next, please. Next, please. So in the Ethiopian food system transformation roadmap, have a game-changing solution. 7 clusters, grouped in 7 clusters. Those in blue colors are, although they don't directly contribute to the healthy diets, but they have indirectly. For example, you know, it was explained that 80% of the population purchase their foods from open market, fresh air market. But there is always a problem of food safety because of adulteration and others. So here we have to strengthen the national food safety. We have to develop, we have to also to support the diversified food production, the consumption of fortified nutrients, not only the food fortification from the industrial, but also biofortifications, and we have to modernize and upscale indigenous food production, and also climate smart livestock value chains. Next, please. So in cluster 2, you know, the direct link for healthy food policy index is the GC10, the National Food-Based Dietary Guideline, which was launched last year in 2023. We hope that the population above 2 years old will use it and keep itself healthy by consumption of healthy diets. But also we have a food and nutrition literacy, GC, that creates awareness on the consumption of nutrient-dense healthy diets. Next, please. So when it comes to the market, we have a GC8, strengthen innovative strategies, mechanisms of supply chain management in the handling system, because we have a very high post-harvest loss, not food waste, but post-food loss. At the same time, we have traditional or informal marketing system. So we have to strengthen innovative ways to have this supply chain management to provide healthy diets to all citizens. Next, please. We have also for the PSNP, for the safety net, inclusive and sustainable social protection, including the school feeding program. Here we have to provide nutrient-dense and healthy foods to the school, because school feeding initiative we have here in Ethiopia, but still what they consume is not healthy and nutritious, so we have to work also on this one. Next, please. So what remain to work in Ethiopia? The first one is, I think, develop nutrient profile models. Consequently, it leads us to developing policies like reducing the advertisement of unhealthy foods and marketing unhealthy foods to children. We have to increase funds for nutrition promotion, especially for food-based dietary guidelines. And we have to reduce the promotion of unhealthy foods to children, not only children, but adolescents also these days. Although there is introduced excise tax on sugar-sweetened beverage, it was not meant for healthy diet. But now, according to the food system, we have to revise it and introduce an excise tax on sugar-sweetened beverage and incentivize the production and distribution of nutrient and healthy diets. Of course, we have to repurpose funds to produce more healthy foods, because there are a lot of development partners, NGOs, CSOs working on the agriculture side, but they have to repurpose their funds to produce more healthy, not only healthy, but it should be nutritious foods. This is what I have. Thank you very much.
Thank you very much, Dr. Cissé. I'm afraid some of your presentation came in and out due to the Wi-Fi connection, but I'm hoping that your slides were very helpful, and in particular, the clustering of policy options I thought was a really valuable point, and something that'd be great to talk a little bit more from in the discussion if we can, or after this event. I think there's lots to learn on there. As for your point about additional fund for food-based dietary guidelines, and of course, agricultural subsidy, interesting there. Now I'd like to welcome our third panelist to the session for today, Dr. Tremont from Brazil. So thank you so much. Over to you. We're looking forward to hearing your insights.
Thank you, Christine, for the introduction. On behalf of Brazil Ministry of Health, I would like as well to thank you, the coalition, for the invitation to present Brazil's showcase. Enjoy the discussion today. So the idea today is to present the Brazilian experiences in food environment and the governmental level. So next, please. First of all, it's important to say that all our food and nutrition public policies are based on our dietary guidelines for the Brazilian populations, which considers a novel approach to a healthy diet. So I highlighted here some of the main points of our dietary guidelines that support an understanding of a health and sustainable food environment concept, which are a comprehensive approach that considers dietary patterns. Health and sustainable diets must derive from a socially and environmentally sustainable food system. Assuming that dietary guidelines enhance autonomy in food choices, consider social, environmental, and commercial determinants of diets such as cost, supply, time, cooking skills, information, and advertising. And at the end, adopt the novel food classification system to advise food choice based on the golden rule: always prefer natural or minimally processed food and recently prepared dishes and meals to ultra-processed food. So next, please. So from this perspective, I will present Brazilian experiences implementing strategies that impact the food environment based on our dietary guidelines. So in the health sector, we have developed a series of initiatives, materials, and health technology to promote capacity building among primary healthcare professionals, focusing on improving diet and nutrition approach in line with our guidelines. Next, please. In the workplace, we implemented an ordinance that defines actions to promote healthy eating in the work environment. This includes the predominant offering of fresh and minimally processed foods and prohibits the offering of ultra-processed foods in the Ministry of Health restaurant. Next, please. In the education sector, within the scope of the National School Feeding Program, we update the resolution that defines the guidelines for food purchase in public schools. This update restricts the purchase of processed and ultra-processed food and prioritizes the purchase of natural and minimally processed food. It's important to note that our school feeding program covers about 40 million students. Next, please. Also in the education sector, we recently had the publication of a decree that establishes actions to promote adequate and healthy eating in the school environment based on the Brazilian dietary guidelines. This decree also mentions actions towards restricting ultra-processed and other unhealthy foods in canteens and food retail outlets near schools. Next, please. In the food and nutritional security and social assistance sector, we had the launch of the government program Brazil Without Hunger, which also states that the principles of the dietary guidelines should be used as a reference for actions in the plan to fight against hunger and food insecurity. The program seeks to ensure that the population experiences food and nutritional insecurity, have access to healthy food, and promoting sustainable food production, taking as reference the principles of the dietary guidelines. Next. Also in the sector, we issued a decree initiating a significant transformation in the Brazilian food, basic food basket, focusing on encouraging healthier and more sustainable eating habits. By prioritizing whole foods and restricting ultra-processed food, it aligns with nutritional policy guidelines and tax reform, demonstrating a commitment to public health and food sustainability. The document emphasized seasonality, family farming, local and regional traditions, biodiversity, and environmental respect, essential elements for food and nutritional security. Through this approach, it seeks to guide the population towards balanced eating practices, ensuring access to nutritionally adequate and sustainable food, especially for the most vulnerable segments of society. Next. We also include the dietary guidelines in the National Food Supply Policy and the National Food Supply Plan to promote access to and provide adequate information about healthy eating. The third axis of the plan, access to food and to healthy food environments, enlists a series of actions such as supplying territories, strengthening the workers' food program, implementing the community and solidarity kitchens program, enhancing school feeding program, and health and adequate food and school environments, and providing incentives for popular restaurants. Next, please. In the National Agroecology and Organic Production Policies and Plan, currently under development, the perspective of food environment is being integrated into various axes and objects, including production, knowledge, marketing and consumption, and social biodiversity. Some of the actions within policy include supporting and promoting food retail outlets such as agrarian reform fairs. Additionally, Brazil Ministry of Health is working on strengthening mapping efforts and supporting research in this field. Next, please. And finally, we had a change in our nutritional labeling, include front of pack warning labels that alerts to high levels of critical nutrients, along with development of educational materials to inform and enhance the population's understanding of what this change means. Actually, the next please will show some materials that you have developed. Yeah. So to conclude, here are some of the strengths and challenges that we would like to share. First of them, a common understanding of the concept of healthy and sustainable food system is essential. A set of public policies, programs, strategies, and systems committed to a sustainable food system embodied in Brazil by the Brazilian Dietary Guideline is also crucial. Intersectoral dialogue and coordination are necessary. And some of the challenges we face include conflicts of interest, industry lobbying, Brazil's vast geographical dimension, diversity, and territorial extension. That's it for today. Thank you.
Thank you so much. Dr. Tremont, what an excellent overview and such a comprehensive collection of actions being undertaken in Brazil. There's so much that the world can learn from, that many other countries can learn from. So thank you very much. Distinguished guests, we're now going to move to the Q&A section. We've had a lovely number of questions being added to the Q&A. So I'm going to ask one question to each speaker that we have. So if all speakers could again turn their cameras on, then that would be great. After Dr. Tremont, I might start with you if that's okay. There's a question in the in the chat that's asking about the very neat alignment that you have between your dietary guidelines and your food policies, and just wondering the mechanism by which that was achieved sort of at a really government level. Often policies are created in silo, they come from a particular department. There's not that sort of coordination across government that you seem to have achieved in Brazil, where there's a direct link to food-based dietary guidelines and policy action. And we'd love to learn a little bit more if we could.
Sure. We have the second edition of our dietary guidelines published in 2014. So since that, we have implemented a lot of strategies along the all sector in Brazil. So this is a kind of give us some efforts to understand this, how you can implement this so successful things. I think this is, it's not, I think you just publish it and then you get achieve all of these efforts, you know.
Yeah, thank you. I guess it's that.
Sorry. You are mute for me? Sorry.
Government, you know, so you've got that cross-level engagement. It was really great. Thank you. Moving right on to the next question. There's one for Jason. And this question, Jason, asks around your how the development of policies around food retail environments for remote areas, particularly with Indigenous people in Canada. And the question is, how did you manage to consider sort of the traditional cultural components in addition to access? And were there any specific, contextually specific strategies or mechanisms that can be learned from your experience?
Okay, what a great question, and a very, very important question as well. Strengthening Indigenous food systems through advancing self-determined food systems, or described otherwise as systems defined and managed by the communities themselves, is a key outcome for the food policy for Canada. Also important to recognize that the food systems of First Nations, Inuit, and Métis Nation partners are distinct, and they vary based on unique priorities of respective communities, and also important to take into account that there's a differing prevalence of market foods, locally produced foods, and traditionally harvested or country foods among communities. So I'd say there are a number of programs across departments, agencies that provide food-related programs, and we've heard from Indigenous partners challenges associated with navigating the patchwork of programs, as well as the process to access funds. Your question, I think, was more in relation to northern and remote communities. In that case, I think we have a bit of a best practice program that was implemented by Crown Indigenous Relations and Northern Affairs Canada, and that is the Harvest of Support Grant and the Community Food Programs. This program operates a bit differently than other Government Canada programs, in that it's not a question of communities having to put forward an application for an individual project to access funds, but rather eligible Nutrition North Canada communities are provided with set allocations, which they can then utilize to determine how to best advance the priorities within their respective communities. So this way they can create programs or other ways to support the communities they represent, and also recognize that each community has unique food security needs and priorities. And so in this way, the program's designed to ensure that Indigenous governments and organizations can decide how to best support their own communities.
Excellent, thank you. I think, yeah, there's again a lot to be learned from Canada's experience, as you said, a real example of best practice there. Next, I just wanted to move on to Heli. So the question, there's a question for you, Heli, which you've partly answered already in the chat, but the question really is about the learnings from the school setting and the importance of the school setting, and how might that be applicable or be able to be applied to university cafes or working environments and working cafes, sort of workplace cafes. So do you feel that they have relevance, and how can they also be applied to adult institutional settings?
Yes, we do believe that if we raise children to be aware if they are good consumers starting from from early age already. So we have seen in our surveys, which we have conducting in daycare services, that actually children are really eager to learn with the new methods that we are teaching them how to choose healthy foods, and actually the small children teach their parents. But to answer to the cafeterias, the young people in the university level, they are really aware of the sustainability and health ideas, and they are consumers that walk with their eyes opened. So we have for also guidelines for the second level education, and also guidelines for working places and so on. So there is a whole set of guidelines which can be found through the National Nutrition Council, which was established in Finland in 1950s. This has helped also to work over the different silos, because in that Nutrition Council there are people from agricultural sector, consumer sector, academia, health sector, etc. I will put the link of the National Nutrition Council's guidelines.
Yeah, that sounds really great, Heli, and that transdisciplinary nature of that working group sounds really very fundamental and important, so that there's consistency across sectors. Yeah, that's really great. Thank you very much.
Thank you.
Moving on to a question for Dr. Cisse. There was a real question for you around, you mentioned food safety, and what are sort of the mechanisms for ensuring food safety in local food markets, as well as healthy and diverse diets? And any learnings that you have from your work there would be most welcome.
Thank you very much. You know, the food safety issue in Ethiopia is alarming. Now we have developed two different strategies. One is the food safety and quality strategy for primary agricultural produce that starts from input to the marketing. So we have a regulatory organization, we call it Ethiopian Agricultural Authority, that regulates the food safety and quality issue in the markets. The second is we have Food and Drug Authority. That Food and Drug Authority is responsible for the processed foods, which are sold in the markets, in the supermarkets. So those two strategies and proclamations will help us to at least avoid the adulteration of products. But still, we have a difficulty on ensuring food safety in the marketplaces. Thank you.
Yeah, thank you very much. It's all those additional supports that are needed. And there was a question that related to citizen trust in food markets too, around food safety. So yeah, thank you very much, Dr. Cisse, for your learnings there. Now we're just going to move on to a final question, one for Sarah and Anna. And this question actually relates to, can we expect from the Healthy Diets Coalition conveners to establish a separate community of practice, which would focus on policies and interventions to provide support through sharing lessons that are learnt by the countries around this important topic?
Thank you, Christina. It's a good question, but maybe this can be answered by the Secretariat and Arganun, because, well, on my side, my understanding is that precisely this line of conversation is designed to do that exactly. But I know this is not a community of practice per se, but Arganun can maybe provide a detailed answer.
Thank you, Anna. And yes, indeed. So I did respond to you, Faiz. Please have a look at the Q&A as well there for a more detailed response. But in fact, this is one of the key roles of the coalitions that came out of the UN Food Systems Summit to bring together the diverse partners and the different country learnings. And so we continue to conduct these types of webinars, and it's not a community of practice as such, but it is still a great platform to bring together the various partners. So please have a look out at our webpage for more upcoming webinars and events, and we look forward to continue the discussions. Thank you.
Thank you. So Anna and Sarah, I have one final question then for you that is from myself, so that there is an opportunity for you to answer a question, which is more around the different policy initiatives that are needed for SMEs versus transnational corporations. And wonder if you've got any key learnings across your work across different countries that might be core takeaways.
Thank you, Christina. Well, those are two very big fields, meaning SMEs and the industry. For SMEs, we know the type of policies they need are those that actually enable them to invest in their own businesses, and especially what we support is the investment into SMEs who are very keen to grow the fresh food and horticultural sector, and marketing those products, which can be then not costly and available for low-income consumers. To do that, they need a lot of support on the capacity sides, or also in terms of financial mechanisms. But these need to be carefully designed together with SMEs, because the financial needs and mechanisms are very different and vary across countries and for different SMEs. But yeah, there's lots of policy frameworks that can focus on supporting the small and medium enterprises, but also those companies and those enterprises who can provide, for example, technology and infrastructure for those SMEs in the country. So the policies need to consider the ecosystems of actors, meaning food SMEs, but also innovative businesses who can provide the technology and infrastructure to those SMEs to be able to bring the food to markets. So this would be one example.
Thank you very much, Anna. I think it's really true that the suite of policies, or the cluster of policies, using Dr. Sisi's term, needs to be quite different, don't they? And yeah, absolutely recognizing that, but it's still a comprehensive action that needs to be taken. Thank you very much for a very detailed answer. Thank you all. Thank you to the delegates and participants and distinguished guests for your lovely questions. And of course, a big thank you to our excellent presenters. What a really whistle-stop tour of policy action that to really improve food, retail and market environment. So thank you very much. I really hope this session has sparked some ideas on how we can collectively work to align policies to achieve healthier food environments. I hope you're all feeling a bit invigorated about engaging with the hidden middle as part of the transformation of food systems for healthier and sustainable food systems. But most importantly, I hope everyone's taken away something that you can do to support healthier provision in your role specifically. I know I have, around thinking more about SMEs, so that's been really helpful. I'd like to now hand over, but just before I do, for the final closing speakers, to our closing remarks from our two final speakers, I just wanted to offer a big thank you to the Coalition for organising this event, particularly to colleagues Aganoun Ferika and to Florence Tonenoir from the Coalition for Healthy Diets from Sustainable Food Systems. So thanks very much for putting on this excellent session today. Just a reminder that if you are not a member of the Coalition and you would like to be, please do reach out to the Secretariat. If you're interested, you can reach out via email. So for the closing of this webinar, it's my pleasure to present two final speakers, Dr. Luz Maria de Regil, from the unit head of the multi-sectoral actions in food systems at the World Health Organization, and of course Boyd Swinburne, who is Professor of Nutrition and Global Health at the University of Auckland, and who also heads up Informus, or takes a lead role in Informus. So thank you both very much for joining us. Dr. Louise, I'll hand over to you first for your closing remarks. Thank you.
Thank you so much, Christina. And I just wanted to thank the participants. I mean, it was a great overview of what is happening in food environments. As you know, WHO has promoted a package of policies to improve food environments that include a prevention of harmful marketing, reformulation of foods to reduce the content of trans fats, eliminate trans fats, reduce the content of sodium, and of course of sugars. Also, the third intervention is food labeling, front of the package labeling, but also now we are entering into the space of menu labeling because it has been requested from by multiple member states. Recently, we launched the guidelines of fiscal measures to tax unhealthy products, but also to find incentives that can incentivize the production of healthier food. The fifth intervention is healthy food procurement, and it's not only through the private sector. The private sector has a great opportunity to use its unique purchasing power to ensure that healthier food are available in hospitals, schools, etc. But more and more, we are seeing that also the private sector is using the WHO guidance to make sure that the catering services are also healthier, or at least have some degree of healthiness. And I don't want to forget that in this conversation, when we are improving food environments, it's not only about prevention of diet-related non-communicable diseases. It's to ensure that populations receive the right amounts of vitamins and minerals, for example, through food fortification. And that those policies for food fortification and those others that I just mentioned, like food labeling, marketing, etc., are fully aligned, so messages are consistent for the final consumers. And in addition to this menu of action, I think that there are two policies that we are using also to complement this menu of actions. One, for very relevant for these retailers, is the use of nudges or behavioral insights to ensure that the architecture where in the way that the architecture of places where food is sold is actually helping to make the populations to make the right choices. And the second part is strengthening food control systems. Our panelists from Ethiopia had already alluded to the relevance to improve food safety, but it's not only about food hygiene in markets. It's about making sure that food control systems have the right structure to make sure that the member states have the ability to monitor the implementation of these food environment policies and to enforce it is necessary. So a lot of these interventions, the way that we have been talking, are happening at the regulatory level. However, it's very important, and we saw a couple of examples, that we contextualize them with a setting-based approach. And again, WHO has produced guidance, for example, for schools. We have how all these policies can be combined for schools to prevent that foods are marketed to children, that there are very labeling in the menus, that foods have a particular nutritional profile, and so on. And the same will happen with workplace. We are working on that. And recently we had an example of how to work on combine these policies for sport events, even mega sport events, as our recent collaboration with Qatar for the World Cup. So it is possible to combine this. Communication is critical for the different audiences to make them happen. It's not only the alignment in the policies but and in the programming, but also making sure that there is continued communications and the messages are reinforcing the implementation of these policies. Otherwise, it's a task that is difficult in many ways because it needs to convince there are multiple interests in this space. I want to, before closing, I wanted to just to make sure that we don't forget that the digital space is also an environment where people are accessing food. And it requires that we think about labeling, that we think about principles for marketing, and that we engage other actors that are not the regular actors that we engage in terms of nutrition and food safety. For digital technologies, we have to engage the communications departments or the Ministry of Education, etc., that are responsible for making some of these decisions and regulating what is happening. I wanted just to share, because I know that I'm short of time, but I wanted to share that WHO is working on multiple initiatives to improve food environments. We have seen remarkable progress by member states to improve the coverage of policies to eliminate trans fats, best practice policies to eliminate trans fats. In the most recent report, we have seen remarkable progress in terms of around 66% of the population is covered with best practice policies. That is a remarkable progress in comparison to 5 years ago, where only 6% of the population was covered with this type of policy. So it shows that if there is commitment, progress can be made. And also bringing the private sector, is possible to make commitments in that area. The second area is sodium reduction, an initiative to reduce sodium. And in this part, I would just wanted to say and reinforce the importance of having not only large international food producers, but also strategies for small and medium-sized enterprises. The effects of these policies are different depending on the partner. And the last piece is the acceleration plan to reduce obesity. We are training and delivering several workshops for member states. And before closing, I know that I'm short of time. I just put on the chat a community of practice. That was a question that came up that WHO has developed, that includes groups to discuss particularly these areas: trans fat elimination, reformulation, marketing, etc. So I invite you to join. It is meant to serve everyone and to provide the right technical advice to this. And I will put a link on our database for global implementation of nutrition actions, where we monitor the implementation of all these policies. So now, Cristina, over to you.
Thank you very much, Luz. Thank you very much for those comprehensive comments. I particularly like that you raised the thought and the point around enforcement, which I think is one of the areas that we haven't necessarily always fully thought through, and we're certainly seeing that roll out in the UK. Over to Dr. Boyd Swinburne, Professor Boyd Swinburne, for closing remarks, who will close the session. Over to you, Boyd. Thank you.
Thanks very much indeed, Cristina, and congratulations for putting this together. It's very nice to see the Health Diets Coalition come out the other side of the UN Food System Summit, which I thought got a little bit overtaken by vested interests in the end. We heard tremendous presentations from Jason and Helly, two leading countries in the amongst high-income countries, and from Mulugeta, the game-changing solutions. I thought they were great. I wish New Zealand had that many game-changing solutions in food. And from Claudia about Brazil. And I've just had a week in Sao Paulo, and you know, Brazil is really inspiring with what it's actually done over the past couple of decades around food. So they've been all excellent examples. But if I can just come back to the point of this presentation, which is around food retail environments, and most of the actions that are happening are actually not necessarily in the food retail space. They're in school food, which is excellent, and taxation and labeling and so on. But as Anna mentioned at the beginning, when we do the food epi, this food retail sector, when we look at the policies, is often the one with the least amount of actions. And Sarah talked about it being the hidden middle. And why is that? And I think it's because food retail environments are considered the domain of the private sector and not a space where governments get involved. And I'd like to really change the idea about that. That is really important for governments to get involved in the retail, actively involved in the retail sector, because these food markets that have been described, and people mentioned at the beginning about the proportion of food that comes from these fresh food markets, they need active protection. For a lot of people who are on the call from Africa and the Indian subcontinent, the ultra-processed food system is coming your way and will overtake these fresh food markets, and you'll end up like high-income countries where our food retail is dominated by supermarkets, which provide a lot of food safety and convenience, yes, but they also dominate the food retail in terms of ultra-processed foods. So, you know, I think let's focus on getting policies that really protect those healthy food markets that we see in low and middle income countries. For high income countries, we're going to have to retrofit if we want a different retail food environment. So just to finish, just next slide, thanks. Just to say that in Informis, the retail food module, it's coordinated by Adrian Cameron from Deakin University. He's working with a lot of Southeast Asian countries. I don't know if he's working with people on the call here, but at the moment for monitoring, as Luz Maria said, the monitoring is actually really important of this. And at the moment we have good tools for measuring the density of healthy, unhealthy and healthy food outlets and identifying food swamps and food deserts. But often that requires very good local government data, geolocation of food outlets, which is a challenge in some low-income countries. But that's one part of the monitoring package that's available. And then the in-store retail environment, we have tools for that, but it's mainly focused on high-income countries and supermarkets and perhaps a little bit in small stores. I know that Adrian is working on several countries to develop monitoring modules on the informal food sector. And there are other aspects like the open food markets and things that do need monitoring modules to support the monitoring of the implementation of them. So yes, a fantastic session, and can I encourage people to return to the purpose of this webinar, which is around food retail environment, and let's make sure that's not left out so that we continue with this kind of hidden middle, as Sarah mentioned. So thanks very much for inviting me.
Thank you very much, Boyd, and thank you everyone. What excellent closing remarks, and I completely agree about the challenges, but we shouldn't they should be overcome. With working with retail food environments, certainly it is challenging, but it's the challenge that we can all rise to. So thank you all for joining us today. We hope you've enjoyed the webinar session. We've really enjoyed the interaction between all the audience, and thank you very much to an excellent lineup of speakers. Thank you.